Now, as a periodontist, you treat gum disease. And we've had you on the program talking about the laser to treat gum disease, this bacterial infection. But you say there's a lot of people that just don't buy into treatment. They hear they have gum disease, they have bleeding gums, they do nothing. But it leads to some very serious conditions according to you. Tell me about it.
Randy, my passion is to get rid of gum disease, not just to save teeth. Because gum disease, I consider it like high blood pressure, the other silent killer. Because you don't know you have it. You don't know you have it. You don't know you have high blood pressure. You don't know you have gum disease. Doesn't cause pain. It's the silent killer. I have a list. I cannot tell you how many diseases you are much more increased risk for if you have gum disease. Alzheimer's disease, 70% increased risk.
Really?
Because what happens is when you have a gum infection, it's not just your gums, it causes an immune response, it causes an inflammatory response throughout your whole body. It's like you think you have an infection in your mouth that doesn't affect any other parts, forget it.
It's in your bloodstream.
It's affecting your whole body.
Okay.
And you got these bugs, you got bleeding, you've got disease. I got a list here.
Read off some of those.
The list here is
problems.
so long that I have to read it off, okay? Because I can't remember all of the things. And all of these things you're at increased risk for. Heart disease, hypertension, diabetes, dementia. That's fairly recently discovered, and it's very, very significant. Rheumatoid arthritis, 4 times more likely if you have gum disease. Premature low birth weight, pancreatic cancer. In men, 59% increased risk of pancreatic cancer if you have gum disease. Stroke, colon cancer now, osteoporosis, prostate cancer, infertility, ED, erectile dysfunction, higher if you've got gum disease, kidney disease, COPD, respiratory disease, pneumonia, esophageal cancer, breast cancer, lung cancer, blood clots, asthma, oral cancer, cognitive impairment, obesity, metabolic syndrome, which includes many of the things I mentioned in metabolic syndrome.
So there's research that this
head and
bacterial
neck
infection.
cancer, all of these have
Really?
research.
Okay.
There are research articles on all of these. Get rid of gum disease. Get rid of the silent killer before it can. One of the doctors at Cleveland Clinic was giving a talk, and he says, if your mouth's not healthy, it can take 7 years off your life, and you don't even know about it.
Interesting.
Get rid of it.
You treat a lot of gum disease in your practice.
I treat a lot of gum
You're
disease.
known for this, reversing it with your laser, things like that. When you clean up their mouth, because you have slides where you show all the bad bacteria in their mouth. When you clean them up, do they report feeling better, sleeping better?
They report being healthier, and they are healthier. And I tell them ahead of time, you're going to get rid of this infection, you're going to feel better. And they do. They know they're healthier.
Really?
They know,
Good.
I'll mention one thing very quickly. Virtually every patient that we've treated that has diabetes, when we get rid of the infection, their A1C level goes down. Their diabetes improves. In almost all cases, there's a strong link between the two. We get rid of the infection, it helps the diabetes.
So the type 2 diabetics, you get rid of the infection in the mouth,
Yes.
and they are better. Their numbers get better.
Their numbers get better. Sometimes they can discontinue the medication or reduce it, but the numbers virtually always get better, and sometimes dramatically.
Now this is your passion. This is like the most important thing to you.
I want to write a book called The Other Silent Killer. I haven't gotten around to it yet, but it's so important and people don't know it.